Welcome to This Week in Physical Medicine and Rehabilitation. This week we're covering 10 notable papers spanning neurorehabilitation and spinal cord injury, musculoskeletal medicine and conservative interventions, and rehabilitation outcomes and supportive care. Let's dive in. Beginning with advances in spinal cord injury and neurorehabilitation, restoring function after severe neural injury remains one of the field's greatest challenges. In a first-in-human open-label trial, Sughi and colleagues investigated the transplantation of induced pluripotent stem cell-derived neural stem and progenitor cells in 4 patients with subacute cervical complete spinal cord injury. Over a 2 to 4 year follow-up period, the primary safety endpoint was successfully met, with no tumor formation or graft-related adverse events, and stable graft sites on imaging. In exploratory efficacy assessments, the median improvement in the International Standards for Neurological Classification of Spinal Cord Injury motor score from baseline to week 52 was 13 points, with 2 patients experiencing conversion from American Spinal Injury Association impairment scale grade A to grade C and D respectively. These gains exceeded spontaneous recovery rates observed in a registry-based cohort, supporting further clinical evaluation of stem cell therapies under short-term immunosuppression. Complementing regenerative approaches, neuromodulation continues to offer non-invasive avenues for functional recovery. Wang and colleagues published a pilot randomized controlled trial in the Journal of Neuroengineering and Rehabilitation, evaluating high-definition gamma transcranial, alternating current stimulation over the primary motor cortex in 42 stroke patients with upper limb motor impairment. Delivered at 70 Hz for 10 sessions, alongside conventional rehabilitation, gamma transcranial alternating current stimulation led to a significantly greater improvement in the Fogel-Meyer assessment upper extremity score compared to sham stimulation, with a mean between group difference of approximately 4.6 points. Quantitative electroencephalography revealed that these clinical gains were accompanied by reductions in ipsilational delta power and restoration of oscillatory balance, highlighting cortical biomarkers that track neuroplastic recovery. Turning to musculoskeletal medicine and joint preservation, clinicians frequently weigh regenerative injections and exercise prescriptions for chronic pain conditions. Burke and colleagues evaluated patient-specific predictors of response to intra-articular platelet-rich plasma injections for knee osteoarthritis in a retrospective review. Among 209 injections in 199 patients, 41% were classified as responders achieving at least a 20% pain reduction or 60% overall pain improvement at 3 to 6 months. Multivariable logistic regression revealed that having fewer than 2 lifestyle-related chronic diseases roughly doubled the likelihood of a favorable response, and paying higher out-of-pocket procedure costs was also associated with better outcomes. Conversely, obstructive sleep apnea was significantly more prevalent among non-responders. For cubital tunnel syndrome, Swanson and colleagues published a cross-sectional study in PM&R examining ultrasound-guided cubital tunnel hydrodissection in 19 extremities. At a mean follow-up of 7 months, improvement in weakness, paresthesias, and pain was reported in 63% of extremities, with pain relief of 50% or greater occurring in 63% of cases and no reported adverse events. Notably, patients with McGowan grade 2 severity showed significantly greater overall symptom and pain relief compared to grade 1, and only 2 patients ultimately required surgical decompression. Regarding conservative management of chronic low back pain, Nunes-Cortez and colleagues performed a systematic review and dose-response meta-analysis. Synthesizing 13 randomized controlled trials, walking programs demonstrated significant reductions in both pain intensity and disability, with moderate to low certainty evidence. Utilizing a restricted cubic spline model, the analysis revealed a U-shaped dose-response relationship, identifying that accruing 1,000 minutes of walking distributed over roughly 8 weeks achieved the largest pain reduction, while 900 minutes achieved the largest reduction in disability. In the realm of rehabilitation outcomes, functional capacity, and physiological profiling in spinal cord injury, SEO and colleagues investigated the association between sarcopenia and motor recovery in a retrospective cohort study. Using bioelectrical impedance analysis at admission, higher appendicular skeletal muscle mass index was independently associated with achieving minimal clinically important difference-defined lower extremity motor score recovery with an adjusted odds ratio of 1.52. The authors established sex-specific muscle mass thresholds that effectively contextualize muscle status and assist in outcome stratification during inpatient rehabilitation. To better quantify physiological capacity in this population, Livek and colleagues validated a novel field test. The Infinity test is a 3-minute all-out wheelchair field test performed in the participant's own wheelchair with enforced synchronous propulsion to estimate peak oxygen uptake in manual wheelchair users with chronic paraplegia. Evaluated against laboratory arm crank-graded exercise tests in development and external validation cohorts, the field test showed no significant mean bias and strong correlation, providing a feasible, ecologically valid tool for clinical and community practice, supported by an open-source digital toolkit. Respiratory management and decannulation in high-level cervical spinal cord injury were explored by Cuvée and colleagues in the American Journal of Physical Medicine and Rehabilitation. Studying 34 patients initially dependent on continuous tracheostomy positive pressure ventilation, the authors evaluated successful decannulation to non-invasive ventilatory support. Decannulation succeeded in 22 of the 34 patients, utilizing mechanical insufflation-exsufflation to clear airway debris. The findings underscore that while continuous ventilator users can be successfully transitioned to non-invasive support to optimize quality of life, adequate bulbar muscle function for secretion clearance is essential for success. Moving to movement disorders and neurodegenerative care, Ankura Siripaibun and accompanied investigators published a randomized controlled trial in disability and rehabilitation, assessing the combination of textured insoles and auditory cue training in 27 individuals with Parkinson's disease. Over a 6-week progressive walking program, participants using textured insoles combined with auditory cues achieved significantly greater improvements in dynamic postural stability, measured by the functional gait assessment, compared to control groups, demonstrating task-specific sensory advantages for balance control. Finally, addressing critical psychiatric complications in acquired brain injury, Sorbo and Bjorklund conducted a registry-based study. 932 matched controls. While the control group experienced 40 cases of suicide and intentional self-harm during follow-up, 0 suicides were identified in the specialized outpatient rehabilitation group, indicating that structured follow-up care may play a vital role in suicide prevention after stroke and traumatic brain injury. If you only have time for one paper this week, make it the trial by Sugai and colleagues in Nature Medicine on neural progenitor cell therapy for subacute spinal cord injury. This first-in-human phase 1 study provides foundational safety data and encouraging early motor score gains, marking a significant clinical step forward for regenerative medicine in spinal cord injury. Here are the key takeaways from this week in Physical Medicine and Rehabilitation. Induced pluripotent stem cell-derived neural progenitor cell transplantation shows preliminary safety and functional gains in subacute cervical spinal cord injury. Gamma transcranial alternating current stimulation improves upper limb motor recovery and modulates cortical oscillatory imbalance in stroke patients. Prescribing approximately 1,000 minutes of walking over 8 weeks optimizes pain and disability reduction in chronic low back pain. Higher skeletal muscle mass independently predicts clinically meaningful motor recovery in patients with paraplegic spinal cord injury. Specialized outpatient rehabilitation is associated with a markedly lower incidence of suicide following acquired brain injury. That's your roundup for this week in Physical Medicine and Rehabilitation. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.